CCMA practice test tips. Question 1. A medical assistant is performing a rapid strep test on a patient. Which areas of the throat should be swabbed? Option A. The tongue and the hard palate. Option B. The peritonsillar areas and the posterior pharynx. Option C. The buccal mucosa and uvula. Option D. The lower gums and the anterior teeth. The correct answer is option B. The peritonsillar areas and the posterior pharynx. The peritonsillar area and posterior pharyngeal wall are the sites where group A streptococcus colonizes and should be firmly swabbed to collect an adequate sample. Avoiding the tongue and uvula prevents gagging and contamination of the specimen. Question 2. What type of isolation precaution requires a healthcare worker to don an N95 respirator before entering a patient's room? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Standard precautions. The correct answer is option A. Airborne precautions. Airborne precautions are required for diseases transmitted by small particle aerosols that remain suspended in air, such as tuberculosis, measles, and varicella. An N95 respirator, or higher, is required. Droplet precautions require only a standard surgical mask. Question 3. Which of the following steps is necessary to ensure accurate reimbursement of an insurance claim? Option A. UP-coding the service to match a higher billing tier. Option B. Ensuring diagnostic codes match the documented clinical findings. Option C. Omitting any modifiers that could complicate the process. Option D. Billing for services that were scheduled but not performed. The correct answer is option B. Ensuring diagnostic codes match the documented clinical findings. Accurate claim submission requires that ICD-10 diagnostic codes precisely reflect the documented clinical findings to establish medical necessity. UP-coding and billing for services not performed are forms of insurance fraud with serious legal consequences. Question 4. A patient presents with a pulse rate of 110 beats per minute. Which medical term should the medical assistant use to document this finding? Option A. Bradycardia. Option B. Bradypnea. Option C. Tachycardia. Option D. Tachypnea. The correct answer is option C. Tachycardia. Tachycardia refers to a heart rate greater than 100 beats per minute in adults. Bradycardia is a rate below 60 bpm. Bradypnea and tachypnea refer to abnormally slow and fast respiratory rates, respectively. Question 5. A patient has been diagnosed with a reportable communicable disease, such as tuberculosis. To which agency is the medical office legally required to report this information? Option A. The Centers for Medicare and Medicaid Services, CMS. Option B. The local or state public health department. Option C. The Occupational Safety and Health Administration, OSHA. Option D. The Joint Commission. The correct answer is option B. The local or state public health department. Reportable communicable diseases must be reported to the local or state public health department as required by state law and CDC guidelines. This reporting enables disease surveillance, outbreak investigation, and contact tracing to protect public health. Question 6. In a normal cardiac conduction cycle, which structure acts as the primary pacemaker of the heart? Option A. Atrioventricular, AV, node. Option B. Bundle of His. Option C. Sinoatrial, SA, node. Option D. Purkinje fibers. The correct answer is option C. Sinoatrial, SA, node. The SA node, located in the right atrium, is the heart's primary pacemaker, generating impulses at 60 to 100 beats per minute under normal conditions. If the SA node fails, the AV node assumes pacing at 40 to 60 bpm. Purkinje fibers can pace at 20 to 40 bpm as a last resort. Question 7. What type of healthcare setting specializes in providing care for patients who have a terminal illness and a life expectancy of 6 months or less? Option A, ambulatory care center. Option B, long-term care facility. Option C, hospice care. Option D, acute care hospital. The correct answer is option C, hospice care. Hospice care focuses on comfort and quality of life for terminally ill patients expected to live 6 months or less. It emphasizes palliative rather than curative treatment. Long-term care facilities provide extended nursing care but are not specific to end-of-life patients. Question 8. A medical assistant is calculating the body mass index, BMI, for a patient. Which of the following measurements are required to complete this calculation? Option A, height and chest circumference. Option B, weight and waist circumference. Option C, height and weight. Option D, age and weight. The correct answer is option C, height and weight. BMI is calculated using height and weight only, using the formula, weight, kg, divided by height, m, squared. Waist circumference is a separate measure of central adiposity and is not part of the BMI formula. Question 9. When attaching EKG limb leads, which color electrode is traditionally designated for the right leg, RL, and serves as the ground? Option A, red. Option B, black. Option C, green. Option D, white. The correct answer is option C, green. In the AHA color coding system, the right leg electrode is green and serves as the electrical ground to reduce artifact. The mnemonic "Ride your green bike," right arm equals red, left arm equals yellow or black, green equals right leg, helps with lead placement recall. Question 10. A medical assistant notices an administrative error where a colleague changed a patient's chart entry to justify an insurance payout. This action constitutes which of the following? Option A, malpractice. Option B, misfeasance. Option C, fraud. Option D, assault. The correct answer is option C, fraud. Deliberately falsifying medical records to obtain payment constitutes healthcare fraud, a federal crime under the False Claims Act. Malpractice involves professional negligence resulting in harm, while misfeasance is the improper performance of a lawful act. Question 11. Which type of advance directive designates a specific person to make medical decisions on behalf of a patient if the patient becomes unable to do so themselves? Option A, living will. Option B, durable power of attorney for healthcare, healthcare proxy. Option C, DNR, do not resuscitate, order. Option D, Uniform Anatomical Gift Act Declaration. The correct answer is option B, durable power of attorney for healthcare, healthcare proxy. A durable power of attorney for healthcare, also called a healthcare proxy, designates a named individual to make medical decisions when a patient lacks decision-making capacity. A living will specifies treatment preferences but does not designate a decision maker. Question 12. Which of the following fasting blood glucose results falls within an abnormal, pre-diabetic range for a non-diabetic adult patient? Option A, 65 mg/dl. Option B, 85 mg/dl. Option C, 115 mg/dl. Option D, 145 mg/dl. The correct answer is option C, 115 mg/dl. ADA criteria define pre-diabetes, impaired fasting glucose, as a fasting blood glucose of 100 to 125 mg/dl. Normal fasting glucose is below 100 mg/dl. A result of 126 mg/dl or higher on 2 separate occasions meets the diagnostic threshold for diabetes mellitus. Question 13. A medical assistant is preparing a patient for a Holter monitor application. Which instruction should be given to the patient? Option A, avoid taking a bath or shower while wearing the monitor. Option B. Remove the monitor electrodes if they become itchy. Option C. Do not engage in any normal daily activities or walking. Option D. Disconnect the monitor before going to sleep at night. The correct answer is option A. Avoid taking a bath or shower while wearing the monitor. Patients with Holter monitors must avoid water immersion, including bathing and showering, as moisture can damage the device and interfere with the recording. Patients are instructed to continue all normal activities, since the purpose of the monitor is to correlate cardiac rhythms with daily activities. Question 14. When administering eye drops, ophthalmic medication, where should the medical assistant instill the drops? Option A. Directly onto the center of the cornea. Option B. Into the conjunctival sac of the lower eyelid. Option C. At the inner canthus near the tear duct. Option D. Along the upper eyelash margin. The correct answer is option B. Into the conjunctival sac of the lower eyelid. Eye drops should be instilled into the conjunctival sac formed by gently pulling down the lower eyelid. This avoids direct corneal contact, which triggers the blink reflex and causes medication loss, and allows the medication to distribute across the eye surface. Question 15. A medical assistant is assembling equipment for a venipuncture. What is the standard order of draw for a complete blood count, CBC, and a routine chemistry panel? Option A. Lavender tube first, then tiger top, SST, tube. Option B. Tiger top, SST, tube first, then lavender tube. Option C. Green tube first, then light blue tube. Option D. Light blue tube first, then lavender tube. The correct answer is option A. Lavender tube first, then tiger top, SST, tube. CLSI order of draw places the EDTA, lavender, tube before serum separator tubes, SST/tiger top, when no light blue coagulation tube is needed. If a light blue tube is ordered, it precedes the lavender. The correct order prevents additive carryover that could alter results. Question 16. A medical assistant is reviewing a list of community resources for a patient who is experiencing food insecurity. Which program would be most beneficial? Option A. WIC or SNAP benefits. Option B. Workers' compensation. Option C. Medicare Part A. Option D. Hospice care assistance. The correct answer is option A. WIC or SNAP benefits. WIC, Women, Infants, and Children, and SNAP, Supplemental Nutrition Assistance Program, are federal nutrition assistance programs specifically designed to address food insecurity. Workers' compensation covers workplace injuries, and Medicare Part A covers hospital services. Question 17. A medical assistant is preparing to submit an insurance claim using the standard paper billing form. Which form is used for outpatient clinic services? Option A. CMS 1500. Option B. UB04. Option C. DA 2501. Option D. CMS 1450. The correct answer is option A. CMS 1500. The CMS 1500 is the universal claim form used by non-institutional providers, including physician offices and outpatient clinics, to submit claims to Medicare, Medicaid, and most commercial insurers. The UB04, CMS 1450, is used by hospitals and institutional providers. Question 18. When discarding a contaminated gauze square saturated with blood, where should the medical assistant place it? Option A. In a regular covered waste receptacle. Option B. In a biohazard puncture-proof sharps container. Option C. In a red biohazard waste bag. Option D. In a recycling container for medical items. The correct answer is option C. In a red biohazard waste bag. Blood-saturated items that are not sharps are classified as regulated medical waste, biohazardous waste, and must be disposed of in a red biohazard bag. Sharps containers are reserved for needles, lancets, and other puncture risk items. Question 19. What is the financial term for the specific dollar amount a patient must pay out of pocket at the time of each medical office visit? Option A, deductible. Option B, coinsurance. Option C, copayment. Option D, premium. The correct answer is option C, copayment. A copayment, copay, is a fixed dollar amount paid by the patient at the point of service for each visit or prescription. A deductible is an annual amount paid before insurance begins covering costs, and coinsurance is the percentage shared between patient and insurer after the deductible is met. Question 20. A medical assistant notes a prescription for a Schedule II controlled substance. Which of the following is a characteristic of Schedule II drugs? Option A. They have no accepted medical use in the United States. Option B. They have a high potential for abuse but are accepted for medical treatment. Option C. They can be refilled up to 5 times within a 6-month period via phone. Option D. They carry a very low risk of physical or psychological dependence. The correct answer is option B. They have a high potential for abuse but are accepted for medical treatment. Schedule II drugs have a high abuse potential with severe psychological or physical dependence risk, yet are accepted for medical use with strict prescribing controls. Schedule I drugs have no accepted medical use. Schedule II prescriptions cannot be called in by phone or refilled.